Thank you, Commissioner. Thank you, Governor, as well. Good afternoon, everyone. As the Governor said, thank you for your flexibility and joining us on a Monday this week. We have a lot of moving parts and a huge team that's been working very hard. As I usually do, I'll start with an overview of the data. We have 39 new cases to report. Generally, our percent positive has been steady and low for the last week, which, as the Governor shared, is an important thing to notice and is good news. Today, the number is around that 1%. Over the past week, we have had days with very high testing numbers. One reason is because we've been doing a lot of baseline testing for college students. Rhode Island is the 8th highest state nationally in terms of percentage of states' populations that are college students. And for example, in the last week, we had 4 days when we did more than 5,000 tests and 1 day when we did more than 8,000 tests. So as planned, the number of tests continue to increase, and this is a good thing. This is how we do case finding. This is how we get people who are positive identified and isolated so that they can recover safely at home without spreading COVID-19 or illness to others. And this is also how we get to their contacts and get them to be quarantined where they can continue to monitor. On those days, it's important for us to look at the percent positive and continue to see the low number that's there as we are increasing the amount of tests being done. So the number of new cases we are finding relative to how much testing we are doing is the critical point to assess. And again, this has been steady, which is a good sign. To continue with our data, we have 80 people currently hospitalized, and 11 people are currently in an intensive care unit in a hospital. In terms of fatalities, we have no new fatalities to report today, as the Governor said. However, over the weekend, we had 5 additional unfortunate COVID-19 associated fatalities reported out. These cases were not associated with each other. We sometimes just see these small peaks and valleys in our data. Either way, each individual is a part of a family and people who care about them, and our prayers are with the families of each of these people. As usual, I want to spend a few minutes today giving you a feel for what we are seeing in terms of our case investigations. And in doing so, I also want to take a minute to give a shout out to the team, the COVID unit, EpiOps, who is working tirelessly, collecting the information on case investigations so that we can be among the states who learn and respond to it and apply the structure and planning that we need to. Many of you may have seen that the CDC director last week, Dr. Redfield, spoke about a study looking at secondary transmission in child care centers in Rhode Island in June and July. It's this same team collaborating with our testing team and our child care centers that really has been at the forefront of what's being done. And it again reiterates, when you have a structure in place and when you have planning done that's implemented in that systematic way, we can be effective as a state together. So let's hear a little bit about the data that we've been seeing from the cases and see the trends, the insights that we are taking from that. If we look at the week of August 12th to August 18th, we had 598 new cases. Of these 598 people, 41 reported recent travel and 45 had recently attended a social gathering. Examples of social gatherings continue to include a variety of parties, a confirmation party, birthday parties, a party at a beach, outing. Another trend that we are unfortunately continuing to see pertains to disparities. During this period, 274 of the 598 new cases who tested positive were identified as Hispanic or Latina. That means of the people who reported race and ethnicity information, 55% of our cases were among people who identified as Hispanic. We are continuing to prioritize partnering with communities to put short-term prevention measures in place. As I've said, through our health equity zones, as one example, we have distributed more than 1 million masks in our high-density communities, and knowing that that's just a piece of it. There's so much more that we need to do. And the governor and I recently had a call with Latino community leaders who are part of the overall Equity Council that Secretary Zeta-Jones continues to lead well. And we talked with them about what else we can do in the short term to get people and communities the resources and the supports they need to be able to prevent transmission of COVID-19. In addition to those short-term approaches, we are also working on the larger, longer-term structural issues, such as housing and employment, that we know contribute to the differences in outcomes that we are seeing. We're going to keep you informed about what we're seeing in this area. In terms of schools, I want to join with the Commissioner and the Governor in also thanking our dear colleague, General Callahan, for his tremendous leadership and his whole team at the Rhode Island National Guard for their phenomenal, invaluable contributions. They have been working tirelessly. I also want to reiterate what I shared last week. Through this Education Operations Center structure, the Rhode Island Department of Health, in partnership with all those engaged, will do our part to continue to be all over any and every case of COVID-19 that is associated with a school, just in the same way we have been doing with childcare. We are also doing an enormous amount of preparation in advance, knowing the planning and structure that is key. And we are asking districts and schools to engage with us in that preparation work. That entails things like making sure that systems are in place to support allowing for testing rapidly in a school community so it can happen quickly and minimize disruption to learning. And as the governor mentioned, setting up a reporting portal so schools have a uniform and structured way to get information to us right away is also going to be key. While we continue to get these systems and structures in place, we are going to continue working with teachers, parents, and other stakeholders to address as many questions and issues as we can. We're grateful for the expert that the governor mentioned who's going to be joining with our team to help inform and respond to questions. And as part of our walkthroughs, we are going to take the approach, not as much as what DBR does and RIDO does with actual inspections, but as the governor said, work collaboratively with the teams, with experts inside and outside of the Rhode Island Department of Health to talk through the different scenarios that arise in classrooms and help ensure the compliance with the guidance is in place. As we have throughout this process, we're going to continue to do everything we can to answer the questions of everyone involved so you can continue to have the confidence of the work that's being done so that you have that choice with returning safely. The same way Dr. Redfield of the CDC lifted Rhode Island as that place that shows confidently how we do it with childcare. We're going to apply that same approach to schools. So